Welcome to Research MD. This is Dr. Pramil Chariat. I also work as a Chief Medical Officer and Associate Professor of Medicine in one of the large medical schools in the United States. We've been doing a series of lectures on alternative medicine, the benefits, the side effects. You know, when we talk about alternative medicine, we always think about the benefits, and a lot of times we forget to think about the side effects. Today we're going to talk about another major side effect. People usually don't think about it, is garlic. Okay, garlic, well known, a lot of benefits. We're not going to talk about it. You know, people always say like, oh, why? You know, sometimes you talk about the side effects of the drug. You know, am I getting paid by a drug company or not? That's not the intention of this talk. I clearly have said in many of my presentation, alternative medicine have proven benefits. But just like any other drug, you know, it has also complications, and we want the public to know that. Every drug you take, doesn't matter, like, you know, Ayurvedic, Chinese medicine, or, you know, the other drugs in the market, the pharmaceutical company, everything has a complication. So we need to know, the whole purpose is to educate you on that, okay? So today we're going to talk about garlic and how does it make you bleed. We're just going to talk about. Studies have shown that garlic can increase your bleeding time. So what's going to happen? There's increased risk of bleeding. You have to be careful about it. Okay, so how does it affect? First of all, we need to go back and look at the active ingredient, which is adenine, which is a methyl compound, and diallyl disulfide, diallyl trisulfide, it's a polysulfide compound, and allicin. Those are the main component in the garlic, kind of causing all this trouble. These are the troublemakers, okay? Next thing we need to know, how does the normal pathway, how does it happen, platelet, right? When we have a bleeding or something, when you have a cut, what happened? What causes the bleeding to stop? When you have a cut, you know, all the platelets come to that area, they aggregate together and form the clot to seal it off, right? That's a normal mechanism. We want that to happen to survive. If there's no blood clot formation, what's going to happen? You're going to continuously bleeding from a cut. So that is the normal pathway. You have membrane phospholipid on the cell membrane, phospholipase A2, that's converted into arachidonic acid, and then prostaglandin H2, and that is converted into prostaglandin I2 and then that's kind of converted into thromboxane A2 by the thromboxane synthase, thromboxane B2, and you get platelets activated, and then eventually platelets come together, clump together, form our blood clot. That's what's happened. Now, how does it affect our garlic? Garlic inhibit this part on phospholipase A2. Okay, they also inhibit thromboxane synthase, and they inhibit thromboxane B2. So decreased production of platelets also could happen. So this platelet cannot get activated. So platelet is not to come to your rescue when you bleed, okay? It also acts on this GP2B3A fibrinogen receptor inhibition and then inhibit it. So platelet activation and platelet aggregation will not happen. And then you got phospholipase C through IP3, calcium mobilization, which also contribute to the platelet activation. Look at my friends over here. It also inhibits this mechanism over here. So platelet, again, will not get activated. There will not be any platelet aggregation. It also, there's another mechanism in there's production of like nitric oxide, guanylate cyclase activation, GTP, CGMB, that kind of usually contribute to the platelet aggregation. Our garlic kind of inhibit there. So many ways on the platelet or clotting pathway, garlic work. That will, what happens is like your platelet aggregation is affected. Platelet will not come to your rescue when you have a cut. You can start bleeding, okay? Now, usually the studies have shown the higher the dose you take, higher the bleeding time, higher the risk. But what you should consider today, let's say you got a surgery plan and you're taking garlic, you should stop it, okay? Got it, like there's no question about it. When do you stop it? Studies have shown you should stop it before 2 weeks. I would even recommend take it, you know, Don't mess with your platelet. Even start like 3-4 weeks ago. Let's say if you have even a small surgery is planned, my friend, please, please stop it before you take it. It's very, very important, because otherwise it's going to increase your bleeding time. Surgery is going to be longer. It's going to bleed like crazy. Be careful. I'm just begging you, when you have surgery and if you're taking garlic, please stop it. And that's the way to protect yourselves. Okay? Thank you so much for watching. We'll be back with another presentation soon. God bless. If you could subscribe to our channel, greatly appreciate it, so we can make more presentations like this. Okay? Thank you.